If you live in Germany and have public health insurance, your contribution may already be higher in 2026. And from 2027, the rules could change again. But the real question is bigger than will my bill go up? It is this. If you are an international resident in Germany, should you review your private health insurance now before the rules get tighter?
The honest answer to that, Sean, is maybe. For some people, yes, it's worth reviewing now. In fact, I should definitely review now. For others, switching because you have one high monthly bill can be an expensive mistake in the long run. Today, we'll separate what's confirmed with the new Gesundheitsreform, with the new bill, what's still only proposed, and what it actually means for your long-term GKV, PKV calculation decision. It's general advice we're going to be giving, not personal advice. And because some 2027 and 2028 changes are still political proposals, we'll be careful with what's final and what's not.
Okay, so let's start with what is already confirmed. What changed in 2026?
Okay, so what hasn't changed is the base public health insurance rate. It's stayed the same. It's still 14.6%, and it has been for a lot of years. What is changing is your average extra contribution. So in German, it's called a Zusatzbeitrag, a supplementary premium. And that rose to 2.9% for 2026. And for most people, that's what they actually feel on their payslip. The base rate did not rise just the same, but the extra contribution increased, and you do feel that.
Average is doing a lot of work here, right?
Correct. So the official average is not what everyone pays. Each public health insurance provider sets its own Zusatzbeitrag. One fund can be lower, another can be significantly higher. So basically, there are two other numbers which really matter here. First of all, the contribution ceiling. The income cap for which public health insurance contributions are calculated. It's called in German the Beitragsbemessungsgrenze, and it's now set at €5,812.50 per month, or €69,750 per year. To put that in simple terms, you never contribute out of an amount more than that. So if you earn €69,750 or you earn €169,750, your contributions are the same. And there's also another threshold, and this is the so-called Versicherungspflichtgrenze, and that's the amount that if people earn above, they can choose to insure themselves privately. This year, that's now set at €77,400 per year.
And these terms are exactly where people get lost. Can we make them a little bit more human?
Yeah, basically 3 words. German can be such a difficult language with such long words, but we'll try and make it easy. Firstly, the extra contribution, the supplementary charge that each provider can decide for themselves in the GKV, is called a Zusatzbeitrag. It's the extra percentage your public health provider charges on top of the base rate of 14.6%. Secondly, important is a contribution ceiling, the so-called Beitragsbemessungsgrenze. This basically decides how much of your income can be used to calculate your contributions towards the GKV. If you earn above the ceiling, your GKV contributions don't keep going up forever. So there is a fixed cap. And thirdly, the private insurance access threshold. So it's called a Versicherungspflichtgrenze. And this decides whether an employee can be allowed to leave the mandatory public insurance and actually choose private insurance, or if he has to stay in the GKV.
So the ceiling is about how much income gets charged.
Exactly. The words are difficult, but the logic isn't actually that hard. It does matter, the distinction, because the 2027 political draft, which is coming, really does affect both numbers. So it's important we understand these before we go on.
So why is Germany changing this now?
Well, basically, our public health insurance system is very good. It's also very expensive, and it's under extreme financial pressure at the moment. According to government figures, basically, the GKV, without any sort of reform, will be looking at a financial gap of about 15 billion in 2027. And they believe by 2030 that would rise to 40 billion, which sounds terrible. It doesn't mean that every individual person suddenly pays thousands more starting tomorrow, but it does mean the system is broken and it needs to find money from somewhere.
And somewhere usually means people start asking, who pays?
The state definitely pays. Employers definitely going to be paying more. Employees are definitely going to be paying more. Healthcare providers have to look at their costs. Doctors, hospitals, pharmaceutical companies are all under pressure. A really important group now is families. Families is a big political topic we'll come on to later. But for international residents, the most important part is not every technical detail inside the reform that particularly matters to them. The important part is public insurance costs are under pressure. The rules around high earners and family insurance may, in fact, will definitely become stricter.
Okay, so what is proposed but not final law just yet?
Okay, so as of May 2026, the reform is cabinet approved. It's still a draft. It still needs to go through Parliament. But considering they have the voting rights, it's going to come. The stated goal of the reform is to stabilize contribution rates from 2027 onwards. Just because they say that, it doesn't actually mean it's a guaranteed result. We'll have to see how it all pans out. One of the most relevant proposed change for high earners is the contribution ceiling could rise. They're talking about an extra €300 a month in 2027, on top of the normal annual increases we have anyway. So the private insurance access threshold will probably also rise by €300 per month. So if we're talking 77,400 now, all of a sudden you have to earn well over 80,000 to be able to insure yourself privately. Yeah, they're from the numbers, they're the big changes which are going to come.
So if someone is close to the threshold for private insurance, this could move the line away from them.
This is true. And it's one of the most important points. So if you're expecting to cross the threshold, so if you're expecting to become eligible for the PKV soon, chances are the threshold's going to move away from you again. So if that happens, you'll be mandatory insured in the GKV for longer than you're actually planning on or expecting on at the moment. There are also some massive family-related proposals. So some free family insured spouses or registered partners could face an additional 2.5% to 3.5% surcharge from 2028. So what they're saying is people who haven't got children under 7 years of age at home will have to pay this extra surcharge, which obviously takes away one of the huge advantages of GKV is that it's a family insurance and you're all insured under the one premium. Depending on the final passing in Parliament and the household situation, they'll see then whether it's 2.5% or 3.5%. Children will always be family insured in the GKV under the current draft, but there are exceptions and the details still might change. So it's an ongoing process. That it's going to change is clear. Exactly what it's going to change to, we're not 100% sure yet until it finally comes through Parliament. And they're also saying some of the co-payments that we have in the GKV may rise by around 50% under the new draft, while the usual annual cap burdens would remain the same. So basically, for example, just to explain what we mean by co-payment, in the GKV, you get prescribed a medication, you go to the doctor, you go to the pharmacy, and there you have to pay a minimum of €5 and a maximum of €10 for that medication. That's a so-called co-payment. So they are expected to rise actually significantly. One thing which probably won't change, the Bundesministerium für Gesundheit, which is basically federal health agency or whatever you want to call it, says your sick pay, your Krankengeld, is not going to be cut. So basically the 70% rule of the maximum that we get during a longer period of work will not change under the current draft. So we're still quite well protected there.
Okay, this is where people make expensive mistakes. Let's go person by person. If I'm an employee on a normal salary, what changes for me?
Okay, so if you're an employee on a normal salary, what you have noticed over the last years and what you notice year for year is that the Zusatzbeitrag, the supplementary fee that each provider can charge, has gone up year for year as well. If that goes up, you obviously pay more straight away. Your employer will pay half of that, you pay half of that, but it's an immediate burden. If you actually earn below the contribution ceiling and the ceiling increases, it doesn't directly hit you. The extra contribution will, but the contribution ceiling, if you earn under that, it doesn't matter how high it goes, you're paying on your actual earnings rather than the ceiling.
And high earners?
Right, high earners obviously feel the ceiling. So let's say you're earning €100,000 and the ceiling goes up from 66,000 like it was last year, to 69,000. That's obviously more that you're contributing, and that ceiling goes up year for year for year. So that's an increase you're going to have year for year for year for year. Again, just to make it clear, the contribution ceiling, the Beitragsbemessungsgrenze, is the one that they use at which they calculate your maximum GKV contributions. So I'll give a simple example here. In 2026, the employee threshold for choosing the PKV was 77,400 euros. If in 2027 they add 300 euros per month to that, then it could, well, then you're going to be paying well over 81,000. Actually, you'll be paying 81,000. That'll be the new line, so you can insure yourself privately. So for people thinking, right, great, I'm going to have a pay rise of 2.5% or whatever at the end of the year. And next year I'll cross the line and I can finally save myself some money and insure myself privately. You're going to see that the line's probably more or less definitely moved again. And that's why timing is an important question here for people. For people under the threshold, one thing, they can either catch up or not. For people who this year are just over the threshold, they need to make a decision now, because that threshold will catch up unless they have a significant pay rise.
Okay, so freelancers and self-employed people.
Right. Freelancers and self-employed people are probably the most exposed group to anything to do with healthcare, because they pay the full contributions themselves. So they don't have the employer paying half. So if you use the official average Zusatzbeitrag of 2.9%, in 2026, the maximum monthly GKV health contribution is about 1,017 euros. And on top of that comes a mandatory long-term healthcare insurance. So you're talking about in total of 1,260 euros. An employee will split that with employees, so it doesn't hurt so much. Still painful, but it doesn't hurt so much. A regular self-employed person or a freelancer will carry that alone. And he'll pay that month for month for month, even if he doesn't use the service or whatever. There's also a minimum income basis in the public insurance. So if 1 month is slow, the bill simply doesn't disappear. They look at it on a yearly basis. So if you have a bad month, you're still going to pay the average of the year before. So if you had a good year the year before and you have a bad year the following year, that really does then become painful, your contributions. Generally, depending on the situation, for a freelancer, for a self-employed person, the GKV can still be a good long-term choice. Has to do with your family plans, has to do with your health level. But the fact is, the monthly cost pressure is actually a real pressure, and it does hurt people.
And for families?
All right, so family insurance, along with health, is the only real reason that I can see why you wouldn't insure yourself in the PKV. So the family insurance is still one of the strongest advantages in the GKV. It basically means somebody goes off to work, and as long as the rest of the family is not earning any money, so children and partner, they're not going to pay anything for their premiums. If rules are met, children and some spouses can be covered without separate contribution. That's one of the things they're looking at changing. So the way they're going to change it is, if the children are over 7 years old, then the 2.5% to 3.5% that we talked earlier for the family insurance is going to come into play. Children will never pay, that's not an issue, but partners will pay. It's different in the PKV. Every family member usually needs their own contract. The 2028 draft surcharge for some spouses will weaken that advantage for the GKV for some families. It won't totally destroy it, but it will weaken it, and we need to do the calculation again, the financial calculation again, what's actually better for us.
Okay, and lastly, students.
So students are less exposed to the big reform policies which are coming, but the basics are still there. Student public insurance is not free. The extra contribution still affects the total price. So Zusatzbeitrag, I will pay whatever happens. What you have to think about is student contributions are fairly low, so a 2% increase on that is not so much, is it, for somebody who's working earning 60,000? When it does become a problem is you can insure yourself in the GKV up until 30 years of age. If you're a student, as a student, after that, you fall out, you become like insured in the GKV of your own free choice, which is a lot more expensive, or you can insure yourself privately, which is normally then the most cost-effective solution for you. So with 30, you will have a cost jump, and then you will notice the changes more.
Now let's get to the question that people really care about. Does this reform mean that people should move to private health insurance now?
Not automatically. This reform makes the decision more urgent for some people. PKV automatically better for them. People who earn just over the threshold now. So if they earn 79,000 euros, and we know it's going to go up next year, they should make a decision this year to change, obviously, because then they'll be caught up by the threshold, and maybe they can't make that decision next year. What you have to remember is the public insurance and the private insurance, they work with a different logic. So the GKV is income based. If your income rises, your contribution rises until you reach the contribution threshold, so the contribution ceiling. If your income falls, your contribution can also fall. It's not on a month-to-month basis because it's always based on your tax returns from the year before. But yeah, basically it will change with your income. PKVs are slightly different. So the PKV insurance depends on your entry age, the level of health that you have when you apply, the level of cover that you want, so your tariff combination that you choose. Requires health underwriting. So once you're in, that's always good. The reason why the underwriting is important, the PKV doesn't have to accept you. The GKV, if you're employed or so, or if you're a freelancer from the EU, they have to accept you. It doesn't matter if you have a serious illness or whatever. The PKV can choose whether they want to accept you or not. So there are two things they can do. They can either turn you down, or they can ask an extra risk surcharge. And these are not guaranteed. One of the common mistakes that people make is they go on to some kind of comparison portal. In Germany, Check24 is the big one normally. They put in their details and they get all of these prices. But these prices are assuming you're 100% healthy. You haven't got a few kilos too much. Your eyesight is 20 or whatever. So it's not actually realistic. That's why getting the advice of a professional who will ideally do a risk assessment with you so he can tell you, right, if you now join the PKV, whichever provider you choose, it's going to cost you exactly that much. And then you can make a decision, because from there you can calculate what it costs in future and so on.
So, who should actually review PKV now?
There are three groups who should review it now before they make a decision. Firstly, employees who already earn above the access threshold. If they're high earners and have a simple family situation, for them, especially if they're not planning on staying in Germany forever, it's a bit of a no-brainer to insure yourself privately. The ones who should urgently review it are the ones who earn just over the threshold, knowing they'll be caught up next year. Secondly, people close to the threshold who may cross it soon. If that threshold rises again in 2027, which it will, the window may close for them that they can change. So maybe it's worth even speaking to their employer now. Can I have €1,000 pay rise? Because in end effect, they're saving money, but their employer is paying half. So the employer is saving money as well. So you can actually talk to employers about that. And thirdly, self-employed people who are paying full contributions by themselves into the GKV, and they don't particularly need a free family insurance or anything like that. Just a quick calculation there. If you earn €3,000 as a freelancer, and we know the contribution to your nursing care and your healthcare is slightly over 20%, that's €600 of your 3,000, which is just going towards your healthcare. When we say review, this is important. When we say review, I'm not particularly saying switch. It means compare properly. It doesn't mean change whatever happens, because both systems are good, but one system's better for the one person, one's better for the other.
Exactly. So, who should be extra careful at the moment?
Okay, so people who should be careful and really do their homework and do their calculations are families who already have children, people planning to have children, anyone who has a serious health condition, anyone with an unstable income. Basically, anyone who's not 100% now should stay in the GKV, because it makes it more flexible in future, because then they still have the choice. People who only want the PKV because the GKV bill this month feels annoyingly high, they should think about it. But to be fair, if the bill is high this month, it'll be high next month, it'll be high the month after. So it doesn't get any less annoying over time. But they should also compare very closely, because making uninformed decisions is often a very expensive form of decision making.
So the message is not to run straight to private.
No, the message is if you are in a group where PKV might fit, review it now. Get the proper advice from proper people. If you're not in that position, don't panic switch. Think about it. And it's like really important. Actually get the proper advice. You have to think about lower premium today. If it's not planned properly in the future, it can become a very expensive mistake later on. So you have to think having a lower premium today, if it's not planned properly, can become a very expensive mistake later on in life.
Exactly. So can you give us a checklist, Matthias, before someone makes a decision?
Generally, there's a few things they should be looking at. So basically, they should look at their status. Are they mandatory in the public, depending on their income? Are they voluntary in the public, depending on their income? Are they self-employed? Are they student? Are they family insured over their partner? They're things which make a big difference. If you're GKV insured, you should look at your provider's rate for the Zusatzbeitrag, the one you actually have, not the average, because they do vary a lot between company and company. One little tip here, even if it's not sensible for you to insure yourself in the PKV, it's also possible to change between GKV providers. So you should have a look how much is your Zusatzbeitrag and what's actually available. That can make a €50 difference a month straight away. You should always look at your income. What's your income in 2026? What's it likely to be like in 2027? Are you near the contribution ceiling? Are you slightly over it? Are you over the threshold that you can insure yourself privately? Things like that you should need to look at. You need to look at your family situation, not just now, but what's it going to look like in the next few years? And if you're thinking about PKV and you're reviewing your PKV option, you have to when you're doing the comparison, this is really important, and this is what we said a few times now. It's not just what you're paying this month. Okay, but let's say you insure yourself with a PKV, you and your partner, and you save money for 3, 4, 5 years, whatever, significant amount of money. And then you have children, and maybe for 3, 4, 5 years, you're paying a little bit more because you're all insured and you haven't got the family. But after that, again, when your partner goes back to work or the children become older, you're paying a lot less again. So basically, don't look at now. Look at the 10-year, the 20-year period that you're actually planning on staying in Germany. If you know you're going to retire in Germany, look at the rest of your life and then work out what's cheaper for you. And what you'll find is normally on a long-term basis, even if you have a family, the PKV is significantly cheaper.
Okay, so the short version is GKV is under pressure. PKV may be worth reviewing for more and more people, but the wrong choice can hurt later.
This is true. So basically, don't panic switch because of what you're paying at the moment. As I say, compare the whole life situation. If you actually want to understand how you calculate that, what it means for you, talk to one of the advisors here at Stay. We've had this conversation 1,000 times before you make any switch. And what we'll do is we'll help you compare all of that, not just what you're paying now, what you're paying over the whole time, what makes sense for you.
Also, keep tracking the changes as they move through the German system. When the rules change, we'll update the guide and explain what it means in plain English, because German bureaucracy is complicated enough. Our job is to make it easier to understand and easier to handle.
Exactly. So at the moment, we're talking about things which are just passing through Parliament. As soon as we have the exact figures, we'll come back to you and we'll tell you exactly what it means in euros and cents, so to say, to you personally. But it is a very exciting topic at the moment, and one which is going on. And I'm very much enjoyed doing this talk, and I'm very thankful for Ray, who's hidden in the background there. And once again, Sean's done a great job, and let's just do one next week.
Germany's easy, just stay.